Head-to-toe assessment demonstration script, Part 1. Overall communication skills include displaying interest, active listening, professional behavior and language, ensuring the patient is comfortable, and using explanations and directions the patient can understand. Introduction. Introduce yourself, including name and designation, ask the patient how they would like to be addressed, and obtain consent for a physical exam. Good morning, my name is Jocelyn and I'm a student in the Western University Nurse Practitioner program. I can see the name on your health card, but what name would you like me to use? What pronouns? Thank you, Kyle. Nice to meet you. Today I'll be performing a head-to-toe physical assessment. We're in a private space, and throughout the exam you can ask me to pause, to stop, or to provide more explanation at any time for any reason. Are you comfortable with me proceeding? General survey. Observe the patient's affect, facial expressions, mannerisms, dress, grooming, speech, orientation, and attention span. Okay, Kyle, during this initial conversation, I'm assessing your level of consciousness and ensuring there's no emergent issues like difficulty breathing that would redirect my assessment. Your affect and your facial expressions are appropriate, and you are pleasant and cooperative. Your speech is clear, it's at a normal rate. You appear oriented to person, place, and time, which you've shown that by arriving as scheduled and engaging appropriately with me. You're dressed for the weather, you're well groomed, you have good personal hygiene, and you're able to maintain attention as we talk. Integumentary. When assessing the integumentary system, use both inspection and palpation to assess the upper and lower extremities for perfusion, including color and capillary refill, the presence, quality, and distribution of hair, temperature, turgor, texture, and moisture or dryness. Assess for lesions, injury, redness, rashes, edema, or abnormalities of the skin. Assess both finger and toenails for color, shape, angle of the nail, thickness, capillary refill, and any lesions or abnormalities. Kyle, throughout the exam today, I'm going to be assessing your skin, but right now, starting with the extremities, I'm inspecting and palpating, looking at perfusion, including overall color, temperature, capillary refill. I'm observing the presence, quality, and distribution of hair on your arms and legs. I'm palpating for temperature, texture, turgor, and moisture. Kyle, is it okay if I do a little pinch on your arm? Thank you. I'm on the watch for wounds or lesions, redness, increased or asymmetrical warmth, edema, and any signs of skin abnormality or injury, including pressure injury. I am including the soles of the feet and between the toes. For your nails, I am assessing color, shape, angle, thickness, capillary refill, and any lesions. Head, neck, and EENT. This includes the head, eyes, ears, nose, sinuses, mouth, and pharynx, the neck including lymph nodes, and cranial nerve testing. Head. For the head, assess skull and scalp, hair, face including facial structures, the jaw including inspection and palpation of the TMJ, and testing of cranial nerves 5 and 7. Kyle, I'm inspecting and palpating the skull for deformities, and I'm checking your scalp for tenderness, lesions, nodules, or scaling. I'm assessing hair quantity, distribution, and texture, and I'm looking for any signs of infestation. I'm observing your face for symmetry, edema, or masses, and I'm palpating the temporomandibular joint. Please clench your teeth while I push on your chin. Thank you. And now, can you smile, frown, and lift your eyebrows? With your eyes closed, tell me when you feel this cotton wisp on your forehead, your cheek, and your chin. And the other side, forehead, cheek, chin. So that just tested cranial nerve 5, the trigeminal nerve, both motor and sensory, and cranial nerve 7, the facial nerve, its motor functions. The sensory function of cranial nerve 7 can also be assessed with taste on the anterior 2/3 of the tongue. Eyes. For the eyes, inspect the external eye structures like lashes, eyelids, and eyebrows. Inspect the sclera, conjunctiva, iris, pupil, cornea, lacrimal apparatus, and observe for ptosis. Test cranial nerve 2, the optic nerve, using the Snellen chart and visual fields. test cranial nerve 3, the oculomotor nerve, by observing Perla. Test cranial nerve 3 further, along with cranial nerve 4, the trochlear, and cranial nerve 6, the abducens, by observing extraocular movements through the cardinal fields of gaze and convergence. Okay, I'm inspecting the external eye structures, lashes, lids, eyebrows, as well as the sclera, conjunctiva, the iris, the cornea, and the lacrimal apparatus. Kyle, can you pull your lower lid down a little? Great. And as I do this, I'm checking for symmetry, signs of ptosis, any discharge, any abnormalities. Next, I want to test the function of your eyes, so we'll do a few tests. Do you use glasses? Okay. So first, let's assess cranial nerve 2, the optic nerve, using a Snellen chart. We're going to use a traditional Snellen chart because I know that Kyle can read a Latin alphabet. But if I didn't know, I would ask and consider variations on the Snellen. Kyle, can I get you to stand right here, 20 feet away from the chart? Okay, cover one eye while you read from the chart, starting at the top and work your way down. I'll stop you once you get 2 incorrect. Okay, and now let's cover the other eye. Wonderful, let's go back, sit down, and we'll check your visual fields. So I'll position myself straight across from you, and then I'll get you to cover one eye again and look at my eyes. Let me know how many fingers I'm holding up when you see them. Okay, and down here in the lower lateral field, over here in the upper medial, and here in the lower medial. Next, I'll look at cranial nerve 3, the oculomotor nerve. Kyle, I'm going to shine a light in your eye, and I'm watching for direct pupil constriction. And in the opposite eye, I'm looking for the consensual response. And I'll repeat that on the other eye. I'm expecting your pupils to be equal, round, and reactive to light. Next, I'll check accommodation. I want you to look at a point way on the other side of the room, and then follow my finger as I bring it close to your nose, and I'll watch for your pupils to constrict. Finally, I'll further assess cranial nerve 3 along with cranial nerve 4, the trochlear, cranial nerve 6, the abducens, by guiding your eyes through the 6 cardinal fields of gaze. Kyle, I'll ask you to follow my pen with your eyes. I'll hold your chin to remind you not to move your head, just your eyes. And I'm going to make a star shape here and have you look in every direction. At the end, I'm looking for convergence as your eyes move inwards together. So just follow the pen as I bring it to your nose. Wonderful. Thanks, Kyle. Ears. For the ears, inspect position, condition, alignment of the external ear. Palpate the auricle, tragus, and mastoid process. Okay, looking at your ears, I'm inspecting for symmetry, drainage, discharge, or signs of injury. The top of the ear should align with the eye at about 10 degrees. I'll palpate the auricle, the tragus, and the mastoid process for tenderness. Next, I'll test cranial nerve 8, the vestibulocochlear or acoustic nerve, using some hearing tests. First, the whisper test. So I'll stand about 2 feet behind you, and I'll whisper some 2-syllable words and ask you to repeat them. So cover your left ear. Baseball, hot dog, toothbrush. Okay, and we'll do the same thing on the other side. Next is the Weber test. I'll strike this tuning fork and place it on the top of your head. Tell me if you hear the sound equally in both ears or louder on one side. And the René test. I'll place the vibrating fork on your mastoid bone. You tell me when you can no longer hear the sound. Okay, then I'm going to hold it next to your ear canal, and you should be able to hear it again. Okay, let me know when you can't hear it anymore. Okay, normally air conduction is about twice as long as bone conduction. Nose. For the nose, inspect and palpate for tenderness, discharge, obstruction, alignment, and deformity. Assess the patency of nares and palpate the frontal, maxillary, and ethmoid sinuses. Looking at your nose, I'm inspecting for symmetry, alignment, discharge, deformity, or septal deviation. I'll just gently palpate the bridge and the septum for tenderness. I'll check the patency of your nares. So I'll have you occlude one nostril at a time, and take a sniff through the other. And the other side. Now I'll palpate and percuss your sinuses. Let me know if you feel any tenderness. First over the frontal sinuses here above your eyebrows, and next the maxillary sinuses here over your cheeks. And finally, the ethmoid sinuses along the bridge of the nose. I want to test cranial nerve 1, the olfactory nerve, which is responsible for smell. So Kyle, I'll get you to close your eyes and occlude one nostril. Okay, I'm going to pass a familiar, non-irritating substance like coffee or peppermint under your nose, and you tell me what you smell. Then we'll repeat that on the other side. Mouth. For the mouth, inspect using a tongue depressor and include the lips, buccal mucosa, gums, teeth, palate, tongue, pharynx, and tonsils. Test cranial nerve 9, the glossopharyngeal nerve, cranial nerve 10, the vagus nerve, and cranial nerve 12, the hypoglossal nerve. Next, I'll inspect your mouth and your throat. I'm looking at your lips, your oral mucosa, the gums, your teeth. I'm looking for color, moisture, and any lesions. I'm inspecting the tongue for texture and symmetry, and I'll check the hard and soft palate, as well as the tonsils and posterior pharynx. Next, I'll assess the motor functions of cranial nerves 9 and 10, the glossopharyngeal and vagus nerves. Kyle, can I ask you to say ah? I'm watching the uvula and soft palate rise symmetrically, and the uvula should stay midline. I'd also check for gag reflex by lightly touching the posterior pharynx. Kyle, can you swallow? I'm listening for ease of swallow, and I've noted the quality of Kyle's voice, since hoarseness may indicate vagus nerve involvement. For the sensory function of these nerves, I would have Kyle taste something on the posterior 1/3 of the tongue. Next is cranial nerve 12, the hypoglossal nerve. Kyle, can you stick out your tongue? I'm checking for midline protrusion and symmetry. And then can you move it from side to side and say light, tight, dynamite. Neck. For the neck, inspect and palpate the position of the trachea. Test cranial nerve 11, the spinal accessory. Rotate the head and shrug shoulders against resistance. Kyle, next I want to inspect and palpate your neck. This can be uncomfortable, just let me know how you're feeling. I'm palpating the trachea to ensure it's midline and not deviated. And I want to test cranial nerve 11, the spinal accessory nerve. So turn your head to the left against my hand, and now to the right. Good. Shrug your shoulders while I press down on them, and I'm checking for equal strength. I want to palpate the lymph nodes, and I'll just name each one as I go. Starting right in front of the ear, the preauricular nodes. Behind the ear over the mastoid process, the postauricular nodes. At the base of the skull, the occipital nodes. Moving under the jaw, just below the angle of the mandible, the tonsillar nodes. Halfway along the unser side of the jaw, the submandibular nodes. At the tip of the chin in the midline, the submental nodes. Along the sternocleidomastoid muscle, the superficial cervical nodes. Deeper under the sternocleidomastoid, the deep cervical chain. Along the edge, anterior edge of the trapezius, the posterior cervical nodes. And finally, just above the clavicle in the hollow at the base of the neck, the supraclavicular nodes. Cranial nerve summary. Cranial nerve 1, the olfactory nerve, a sensory nerve tested with familiar scents like coffee or peppermint, one nostril at a time. Cranial nerve 2, the optic nerve, a sensory nerve tested for visual acuity using the Snellen chart and visual fields by confrontation. Cranial nerve 3, the oculomotor nerve, a motor nerve tested with pupillary response to light, direct and consensual, accommodation, and extraocular movements. Cranial nerve 4, trochlear nerve, a motor nerve tested with extraocular movements, specifically downward and inward gaze. Cranial nerve 5, the trigeminal nerve, both sensory and motor, motor tested by clenching teeth against resistance, sensory tested with light touch on the forehead, cheek, and chin. Cranial nerve 6, the abducens, a motor nerve, tested with extraocular movements, specifically lateral gaze. Cranial nerve 7, the facial nerve, sensory and motor, motor tested with facial expressions including smiling, frowning, raising eyebrows. Sensory function tested with taste on the anterior 2/3 of the tongue. Cranial nerve 8, the vestibulocochlear or acoustic nerve, a sensory nerve tested with the Whisper, Rene, and Weber tests. Cranial nerve 9, the glossopharyngeal, and cranial nerve 10, the vagus nerve, are closely related sensory and motor nerves. Motor function is tested with swallowing, palate rise and ovulum movement when the patient says ah, and gag reflex. Sensory is tested with taste on the posterior 1/3 of the tongue. Cranial nerve 11, the spinal accessory nerve, a motor nerve tested with head rotation against resistance and shoulder shrug against resistance. Cranial nerve 12, the hypoglossal nerve, a motor nerve tested with tongue protrusion, lateral movement, and articulation of light, tight, dynamite. Part 2 to follow.